We nurses, as part of the International Council of Nurses, can speak together as one voice to influence health policy, improve access to quality and cost-effective care, and to enhance the health of populations, especially individuals living with HIV/AIDS. Nurses can impact public policy through advocacy from a unique perspective. The clinical experiences nurses encounter daily provides real-life examples demonstrating the needs of patients and the outcomes of public policy on patient morbidity and mortality. Nurses and the nursing profession should not be underestimated in their ability to influence access to appropriate, efficient, and effective care. What is advocacy? This involves the process of persuading someone to at least consider one's point of view. Nurses have been advocating for centuries, uncovering patient needs and identifying ways to meet these needs. Nurses have ample of opportunities to observe firsthand the positives and negatives of the healthcare system. This enables them to identify needs and concerns related to the care patients receive or don't receive. The knowledge, experience, and skills nurses possess makes them excellent candidates for advocacy. Nurses can create enormous changes in how HIV and AIDS is addressed by engaging in the advocacy process in the community and at all levels of that impact healthcare access, cost, and quality. When nurses are given the ability to share experiences and insights with the public and/or elected officials, nurses can effectively advocate for patients and families while becoming a powerful force in the policy-making process. In the community, nurses can advocate on behalf of economic issues. The cost of healthcare continues to rise, making it difficult for patients to receive the care that they need. Families are often willing to share with the nurse the difficulty they are experiencing in obtaining needed treatments due to the cost of these treatments. Engaging in conversations with patients, neighbors, and the general public can highlight these situations and help nurses address inadequate funding and the effect of this inadequacy on patients' failure to receive appropriate healthcare services. A small amount of effort on the part of a nurse can go a long way in helping patients obtain the healthcare resources they need. Prescription drug costs burden many healthcare users. Patients have expressed their need to limit the frequency with which their prescriptions are filled because they can't afford the co-payments, or because they lack knowledge regarding how to obtain discounts and community resources to fill their prescriptions. In this case, nurses must be aware of a number of resources, either within the immediate community or within pharmaceutical companies themselves, that can help those who have difficulty paying for their prescribed medications. These resources may include programs in local stores that offer significant cost savings in terms of pricing for medications. Nurses can advocate for patients by sharing this information and by working with pharmacies to price match pharmaceuticals for patients, helping them get the medications they need at an affordable cost. Advocacy in the legislative process is an 8-step cycle comprising of values and beliefs, emergence of problems and issues, knowledge and development of research, public awareness, political engagement, interest group activation, public policy deliberation and adoption, and regulation, experience, and revision. Nurses are leaders in building capacity and promoting collaborative actions with other healthcare professionals and decision makers to improve the health for HIV and AIDS. Clear and concise policy and inclusion of nurses as participants in policy development at all levels of the healthcare system are needed in building in-country health infrastructures for prevention, care, and treatment. Policy affects nurses' day-to-day work, especially when dealing with HIV/AIDS patients. We need policy for protection of all workers, including nurses, from infection and taking care of HIV/AIDS patients. Current policies predominantly stem from a top-down approach. This approach prevents nurses from actively participating in policy development. We as nurses need to advocate for the promotion of an upstream approach, whereby individual nurses and nurses as a profession are consulted on the issues related to their workplace and experiences in the fight against HIV/AIDS. It is essential that nurses are able to effectively influence change at all levels, such as local, organizational, systems, national, regional, and international. These influences will contribute to the standardization of well-developed policies in which nurses can rely on in practice.
Created using Powtoon.